Okay, so picking up with the endocrine system, we're going to start getting into the specific glands and the hormones that they secrete. The first we're going to talk about is going to be the anterior pituitary gland. And the anterior pituitary gland is actually going to secrete 6 hormones. They are growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone, and prolactin. All of the anterior pituitary hormones are proteins. All except growth hormone will activate via the cyclic AMP second messenger system at their targets. So they're going to bind to those receptors, activate G protein, and the second messenger is going to end up being cyclic AMP. Thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone are all tropic hormones, which means they regulate the secretory action of other endocrine glands. So these particular hormones are actually going to end up controlling the secretion of other glands that we'll talk about in a few minutes and their respective secretions. Growth hormone is going to be a very common hormone that's produced by the somatotroph cells within the anterior pituitary. The growth hormone is going to stimulate most cells, but will target bone and skeletal muscle. It will also promote the synthesis and encourages the use of fats for fuel. It is also, most of its effects are going to be mediated indirectly by insulin-like growth factors. Now, growth hormone is actually going to be regulated by the secretion of hormones from the hypothalamus. Now, the hypothalamus is actually a structure within the brain that is going to have both neural and hormonal functions. On the hormonal side, what's going to happen is growth hormone will be regulated by 2 hormones secreted by the hypothalamus, growth hormone releasing hormone, and growth hormone inhibiting hormone. The direct action of growth hormone will stimulate the liver, skeletal muscles, bone, and cartilage to produce insulin-like growth factors. Insulin-like growth factors will actually mobilize fats, elevate blood glucose by decreasing glucose uptake and actually encouraging the breakdown of glycogen. If you have a hypersecretion of growth hormone, that can result in gigantism in children. In adults, it can actually result in a syndrome called acromegaly. Hyposecretion in children, this actually results in pituitary dwarfism. If you have a deficiency in growth hormone, this is something that can actually be supplemented these days, and they can give endogenous growth hormone to somebody that needs it. Okay. Thyroid stimulating hormone is going to be produced by the thyrotroph cells of the anterior pituitary. This will stimulate the normal development and the secretory activity of the thyroid glands. The regulation of thyroid stimulating hormone is going to be by a hypothalamus hormone called thyrotropin releasing hormone. It is inhibited by the rising blood levels of the thyroid hormones that act on the pituitary and the hypothalamus. So you have the hypothalamus, which will secrete thyrotropin releasing hormone, which acts on the anterior pituitary to secrete thyroid stimulating hormone, which then acts on the thyroid gland to produce thyroid hormone. The production of thyroid hormone will actually inhibit the anterior pituitary and subsequently also the hypothalamus. So this is a negative feedback shutdown. Adrenocorticotropic hormone, this is secreted by the corticotrophs of cells of the anterior pituitary. This will stimulate the adrenal cortex to release corticosteroids. The regulation of adrenocorticotropic hormone is triggered by the hypothalamic corticotropin releasing hormone, or CRH. This is done in a rhythmic pattern, usually in a daily pattern. Internal and external factors such as fever, hypoglycemia, and stressors can alter the release of corticotropin releasing hormone. Your gonadotropins, these are going to be your follicle stimulating hormone and luteinizing hormone. They are going to be secreted by the gonadotrophs of the anterior pituitary. Follicle stimulating hormone will stimulate gamete or egg and sperm production. Luteinizing hormone promotes the production of gonadal hormones. This is typically absent from the blood of pre-puberty boys and girls. Regulation is by a hormone from the hypothalamus called gonadotropin releasing hormone. And once the hypothalamus starts secreting gonadotropin releasing hormone, that is actually when a girl or boy enters into puberty, because now you have the release of FSH and LH from the anterior pituitary, which are now going to act on either the testes or ovaries. Prolactin, this is going to be secreted by the lactotrophs of the anterior pituitary. This will stimulate milk production. Regulation of prolactin, typically in a normal state, prolactin is actually inhibited by a prolactin inhibiting hormone. However, you start to see levels rise towards the end of pregnancy, that is of prolactin, and suckling will stimulate prolactin release and promotes continuous milk production. Now, the pituitary gland is also going to have a posterior structure, and the posterior structure is going to actually secrete two hormones. Those two hormones are actually going to be produced by the hypothalamus. So the posterior pituitary will contain axons from the hypothalamic neurons, and the posterior pituitary will store ADH, which is antidiuretic hormone, and oxytocin. They are released by the posterior pituitary in response to nerve impulses, and both will end up using the PIP2 calcium signaling mechanism at their targets. Oxytocin is a very powerful hormone that stimulates uterine contractions during childbirth. It also triggers milk ejection or letdown in women producing milk, and it can play a role in sexual arousal and orgasm in both males and females. ADH, on the other hand, is a very important hormone in regulating water balance. Hypothalamic osmoreceptors, so these are receptors that we find in the hypothalamus that pick up the concentration of, say, fluid in your body, respond to changes in solid concentrations that are found in blood. If solid concentration is high, osmoreceptors will depolarize and transmit impulses to the hypothalamic neuron. So if you have too many solids, that means you're dehydrated. That will actually lead to ADH being synthesized and secreted by the hypothalamus and secreted by the posterior pituitary. And what ADH does is it will act on the kidneys and actually inhibit the production of urine. If solid concentration is low, ADH is not released, allowing for water to be excreted as normal. Alcohol is a very powerful inhibitor of ADH secretion. And if you drink a lot of alcohol, or if you're drinking alcohol, that will actually inhibit ADH production, which means the more you drink, the more alcohol you have, the less likely you're going to urinate. More likely you're going to urinate. And that could actually offset your water balance. You could become dehydrated. ADH deficiency, this is diabetes insipidus, where you have huge output of urine and intense thirst. ADH hypersecretion, this is after neurosurgery, trauma, or secreted by cancer cells. And this can actually result in a syndrome of inappropriate ADH secretion. And that's your posterior pituitary gland. The thyroid gland, this will actually consist of two lateral lobes connected by a median mass called the isthmus. It is composed of follicles that produce glycoprotein, thyroglobulin, colloid, which will fill the lumen of the follicles and is the precursor of thyroid hormone. And then you'll also have some cells called parafollicular cells, which are actually going to produce a hormone called calcitonin. So here's your thyroid gland right here. I will just make a little note. Females tend to have much more issues with their thyroid gland than males do. And sometimes if this thing is hypersecreting, one of the things they might need to do to correct that is actually go in and kill the thyroid gland. Okay, or if you have thyroid cancer, you know, they might have to go in and kill the thyroid gland. They try not to actually go in and surgically remove this structure. And the reason why they try not to go in and surgically remove this structure is look where it's nestled. It's nestled around your windpipe, which is fine, but you have your carotids, you have the arch of the aorta right here, you have a lot of major blood vessels that are sort of very close to this. And if you accidentally nick any one of these vessels, that could be very serious. So oftentimes what they'll do to kill the thyroid gland is they will treat you with radioactive iodine. The only structure in the body that uses iodine is actually the thyroid gland, because it takes the iodine up and it's used for the production of thyroid hormone. Most Americans get their iodine supplements through salt. If you note that salt is iodized. But by using the radioactive iodine, what happens is the iodine gets injected into you, it ends up in the thyroid gland, and the radioactive iodine kills the thyroid gland. Thyroid hormone is actually two related compounds, T4 and T3, but just collectively know it as thyroid hormone. Thyroid hormone is your major metabolic hormone. It increases the metabolic rate and heat production, and plays a role in the maintenance of blood pressure, regulation of tissue growth, development of skeletal and nervous systems, reproductive capabilities. So it is a very, very important hormone, and it has its hands in a lot of different aspects. Hyposecretion in adults, this is mixed edema. This is an endemic goiter if due to lack of iodine. Again, not something we see in the US. Hyposecretion in infants can lead to cretinism, and hypersecretion is Graves' disease. And here you can see some images of cretinism in A and Graves' disease in B. And in A, you can even see the goiter form. This is something that we do see in some developing countries. Calcitonin, on the other hand, this is actually produced by the thyroid gland, but in what we call parafollicular cells, or C cells. Calcitonin is going to be antagonistic to another hormone we'll talk about in a minute called parathyroid hormone. And what calcitonin does is it inhibits osteoclast activity and therefore the release of calcium from bone matrix. So calcitonin actually promotes the uptake of calcium and prevents the breakdown of bone for calcium. Your parathyroid glands, on the other hand, these are tiny little glands that are embedded within the thyroid gland. And the parathyroid glands will actually secrete a hormone called PTH, or parathyroid hormone. Parathyroid hormone, you can see the little glands here embedded, these little tiny dots right here. Parathyroid hormone is going to have the opposite effect of that of calcitonin. Parathyroid hormone actually will, if your blood calcium levels drop, parathyroid hormone will stimulate osteoclast activity to digest the bone matrix, which will enhance the reabsorption of calcium and secretion of phosphate by the kidneys. It also promotes the activation of vitamin D, increases the absorption of calcium by the intestinal mucosa. Parathyroid hormone will have a negative feedback control. Once blood calcium levels return to normal, that will end up shutting off the parathyroid hormone release. This is just a diagram showing you that negative feedback mechanism. Hypoparathyroidism, this is usually due to a tumor. What happens with this is you're getting excessive breakdown of bone. This will lead to softening and deformation of the bone. Elevated calcium will depress the nervous system and can contribute to formation of kidney stones. Hypoparathyroidism, This is following gland trauma or removal. This results in tetany, respiratory paralysis, and death. And actually, this actually could be an issue because if you don't have enough calcium, that can affect things like muscle contractions, nerve stimulation. Remember how important calcium was for skeletal muscle contractions. Okay, your adrenal glands. These are paired, pyramid-shaped organs that sit on top of the kidneys. Structurally and functionally, there are two glands in one. You have the adrenal medulla, which is nervous tissue, and it's part of the sympathetic nervous system. And the adrenal medulla is going to secrete chemicals called norepinephrine and epinephrine, which is part of your adrenaline rush. The adrenal cortex, this is 3 layers of glandular tissue that will secrete your corticosteroids. And you have 3 different layers, the mineralocorticoids, glucocorticoids, and your gonatocorticoids. And don't worry about the different zones. I'm not going to ask you about those. But know the 3 different types of hormones that are produced. So the mineralocorticoids, these are going to regulate your electrolytes, primarily sodium and potassium, in your extracellular fluid. The importance of sodium affects extracellular fluid volume, blood pressure, levels of other ions. The importance of potassium is that it sets resting membrane potentials. And one of the most important mineralocorticoids that gets secreted from the adrenal medulla is called aldosterone. Aldosterone will stimulate sodium reabsorption, and by absorbing sodium into the body, you're going to have water that follows with that as well. So aldosterone can actually be used to also in blood pressure or blood pressure regulation. I'm not going to get into this here, but when we get to the urinary system, we're going to talk about aldosterone secretion and how it fits into this whole renin-angiotensin mechanism. The renin-angiotensin mechanism is a cascade of events to help if your blood pressure is too low. How do you get that blood pressure back up? Okay. Again, you can sort of read through this right now, but again, we're going to get into this with the urinary system because that's really where we're going to see this at play. Imbalances of aldosteronism. This is hypersecretion, which is due to adrenal tumors. If you're secreting too much aldosterone, that can actually result in hypertension and edema due to excessive sodium absorption. Excretion of potassium, leading to abnormal function of neurons and muscles. Now your glucocorticoids, this is the most common one's going to be cortisol. This helps to keep blood sugar levels relatively constant. It helps to maintain blood pressure by increasing the action of vasoconstrictors. Cortisol is the most significant glucocorticoid. It's released in response to Adrenocorticotropic Hormone from the anterior pituitary and patterns of eating and activity and stress. So stress actually causes the release of cortisol, which you may have heard. This promotes rise in blood sugar, blood glucose, fatty acids, and amino acids. Hypersecretion of glucocorticoids. This is referred to as Cushing's syndrome, which will depress the cartilage and bone formation. It will inhibit inflammation, can also depress the immune system, and promote changes in cardiovascular, neural, and GI functions. Hyposecretion, this is also called Addison's disease. This involves deficits in mineralocorticoids, which leads to a decrease in glucose and sodium levels, weight loss, severe dehydration, and hypotension. Here you can see a patient with Cushing syndrome, where you end up with sort of that hunched back of fat in the upper back region. Sex hormones, these are gonatocorticoids. Most are androgens, which is your male sex hormones. They are converted to testosterone in tissue cells or estrogens in females. They contribute to the onset of puberty, the appearance of secondary sex characteristics, as well as the sex drive. And those are all from the adrenal cortex, those 3, the glucocorticoids, gonatocorticoids, and The glucocorticoids, the adrenocorticoids, and the aldosterone secretion, mineralocorticoids, sorry. The adrenal medulla, this is the region of the adrenal gland that will end up secreting two types of secretions, epinephrine and norepinephrine. These hormones will cause blood glucose levels to rise, blood vessels to constrict, the heart to beat faster, blood to be diverted to the brain, heart, and skeletal muscle. What epinephrine and norepinephrine do is they are part of your adrenaline rush, and they will sort of come out during fight or flight mechanisms. When we get to the nervous system, we talk about the sympathetic nervous system. We're actually going to get back into norepinephrine and epinephrine and part of that whole sympathetic response. Your pineal gland, this is a small gland that hangs from the roof of the third ventricle. Pineal cytes will secrete melatonin, which is derived from serotonin. And what melatonin does is it helps affect the timing of the sexual maturation and puberty. But more importantly, it plays a huge role in your day-night cycles. It plays physiological processes that show rhythmic variations, meaning it controls body temperature, sleep, appetite. And you might be aware that certain individuals will take melatonin endogenously to help them with sleeping or help their sleeping patterns. The pancreas is actually going to be an organ that we'll get into with the GI tract, but this particular organ has both exocrine and endocrine functions. The exocrine functions are going to be producing pancreatic juice. Again, we'll get to that when we get to the digestive system. As far as the endocrine functions, we have two hormones that get secreted by the pancreas, and that is insulin and glucagon. Insulin is secreted by beta cells, and glucagon will be secreted by alpha cells. And glucagon is going to be a major target is the liver, where it promotes gluconeogenesis, which is the breakdown of glycogen to glucose. So glycogen is how we store excess glucose in the body. And when you need to release that excess glucose, what happens is glucagon can do that. Gluconeogenesis, this is the synthesis of glucose from lactic acid or other non-carbohydrate sources. And the main effect of glucagon is to actually release glucose into the blood. Insulin is an antagonistic hormone to glucagon, and it will have the opposite effect, where you are getting glucose out of the blood and storing it as either glycogen, or you're storing it as fat. And the whole purpose of insulin is to lower your blood glucose levels. Okay. And what the body tries to do with the pancreas is this balance of maintaining blood glucose levels. Normal blood glucose levels should be about 90. An imbalance of insulin, this can lead to diabetes mellitus. This is due to hyposecretion or hypoactivity of insulin. Usually diabetics, before they become diagnosed with diabetes, will have huge urine output, excessive thirst, excessive hunger, and food consumption. These are all signs of diabetes. Okay. Ovaries and placenta. The gonads will produce steroid sex hormones. The ovaries produce estrogens and progesterone, which is responsible for the maturation of the female reproductive organs, the appearance of female secondary sexual characteristics, breast development, and cyclic changes in the uterine mucosa. The placenta will secrete estrogens, progesterone, and human chorionic gonadotropin. The testes will produce testosterone that will initiate maturation of the male reproductive organs. The testosterone will cause appearances of male secondary sexual characteristics and a sex drive. It is necessary for normal sperm development, and it also maintains reproductive organs in their functional states. Those are your major endocrine organs. Okay. At the onset of, in part one of the recordings, I did say that we had other organs that played very important roles. The heart, which is not an endocrine organ per se, it has its own function in its own right. secretes atrial natriuretic peptide. This reduces blood pressure, blood volume, and blood sodium concentration. You have receptors in the heart that will pick up if there's a high pressure going through the heart, and ANP could help to rectify that. In the gastrointestinal tract, when we get to the GI tract and the digestive system, we're going to talk about an enteroendocrine system. This is sort of a little circulation where you end up secreting various hormones that help with digestive functions. The kidneys will secrete renin, and renin is part of that whole regulation of blood pressure with the renin-angiotensin aldosterone system. The kidneys will also secrete erythropoietin. Erythropoietin is the hormone that will regulate red blood cell production. Your skin will secrete cholecalciferol. This is actually a vitamin precursor for vitamin D. And then adipose tissue will secrete leptin, which is involved in appetite control and will also stimulate increased energy expenditures. The skeleton, specifically the osteoblast, will secrete osteocalcin, which prods the pancreatic beta cells to divide and secrete more insulin, improving glucose handling and ultimately reducing body fats. The thymus will secrete thymulin, thymoproteins, and thymosins. These are all involved in the normal development of T lymphocytes. T lymphocytes play an integral part of your adaptive immune response. Okay, let's see. Some developmental aspects. Your hormone-producing glands arise from all three germ layers. Developmental germ layers, exposure to pesticides, industrial chemicals, arsenic, dioxin, and soil and water pollutants disrupts hormone functions. Sex hormones, thyroid hormones, and glucocorticoids are vulnerable to effects of pollutants. The ovaries will undergo significant changes with age and become unresponsive to the gonadotropins at some point. This is when a female enters into menopause, leading to estrogen deficiencies. Testosterone can also diminish with age, but the effect is usually not seen until a male is in their 70s or 80s, actually. Growth hormone levels will decline with age, and this accounts for muscle atrophy with age. Thyroid hormone declines with age. This will also affect metabolism, and you start to see a lack of metabolism or a decrease in metabolism. That's why they tell, the older you get, the more exercise you should do, even if it's just walking, because that helps to increase your overall metabolic rates. Parathyroid hormone levels remain fairly constant with age, but lack of estrogen in older women makes them more vulnerable to bone demineralizing effects of PTH. Unfortunately, in women that have lost estrogen support, osteoporosis is something that can develop. Okay, and that is it for the endocrine system. We will talk about this at our next discussion, and we'll go over some of that stuff. So hopefully you guys will have had a chance to sort of listen to this and sort of look over these notes. All right, have a good weekend, and I will see you guys next week.